going. Call the March 16th, 2020 Belvidere City Council regular meeting to order. The clerk will call the roll.
Arevalo?
Here.
Brereton?
Here.
Crawford's going to be absent. Frank?
Here.
Freeman's going to be absent. McGee is going to be absent. Porter?
Here.
Radcliffe?
Here.
Snow?
Here.
Stevens?
Here.
7 present.
Okay, would you please stand for the Pledge of Allegiance and remain standing for the invocation. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Heavenly Father, tonight's a little different situation. We come to you that you be with us this evening as we conduct business for the city and our citizens, but we ask you to imbue us with strength and perseverance and hope as we battle an enemy that we've not faced at this magnitude before. Please be with each and every one of us in our homes, with our young people and our old people, with our medical people, with everyone who is working so hard to find a solution to this menacing virus. In your name we pray. Amen. Okay, we will start off with public comment this evening, and Mr. Rashid is here, is that correct? Did I pronounce your name wrong?
Yeah, Rator, last name Rator.
Rator? Mr. and Mrs. Rator?
No.
Okay.
He wishes.
Okay, y'all come up.
You can come up to the podium.
Don't tell him.
Oh,
You have to have a little humor, you know.
Yes,
In
it
times
helps.
like- In times like this.
a good yuck is a good yuck. Please state your name and for the record.
My name is Indra Rator.
Yeah. Hi, my name is Indra Rathore. I'm here for House of Bottle.
So please let us know what you want to talk to us about.
Okay.
Sir, just.
You don't have to hold it
This is
down.
again. Okay, so I'm here for a gaming board for the license for the gaming video. I applied for a couple months ago and I was approved for the license. Now I was following city rules and they tell me you will get the license end of the February because I have to wait for a period for 60 days for some other location was closed. So when I tried to get the license at the last minute, they told me you will not get it because someone was applying in that location. But when I did apply the license, they told me before you apply the license, you have to have a state license. So I do have a state license with that, but the other person who's applying at that location, he didn't have a state license yet, but he's already automatically going to be approved because because of the location. So I'm asking city, they can increase the license instead of the 30, they can do 31, you know.
So a little background, I can't remember which entity it was that closed.
Lacey.
Thank you, Lacey's Place. Closed business, and your code, as you recall, 2 years ago or so, we decided to cap the number of locations that could have video game in the city at 30. To do that, we created a location permit. The location permit is free of charge, but there's only 30 location permits available within the city of Belvidere at this point. In creating that ordinance, the council decided that unlike our liquor ordinances, which they're not transferable, they don't go with, they don't transfer when you sell a business or even location. The location permit is tied specifically to that location, and so long as another entity opens up in that location, that place is still approved under the location permit. It does provide that if the gaming terminals are abandoned, as being defined as being turned off for 60 days or more, then that location permit goes back to the city and it's no longer valid. So Lacey's Place did close but before the expiration of the 60 days, a new entity has taken over that property and applied for their gaming permits and liquor licenses and everything else, at least the liquor licenses. So they beat the 60-day window, leaving House of Bottles kind of out in the cold because that permit is still valid for the location where Lacey's Place used to be. And we are capped at 30, so there's no location permit to grant him at this point.
So please refresh our memory, what would be the appropriate procedural path to follow to apply to the council to grant another license?
Well, if the council wished to expand from 30 to 31, any number, they wish to expand the number of locations available to have video game within the city, would go to committee, and there'd be an ordinance drafted by myself after approval by the committee, and there'd be an ordinance amending our code to allow 31 or whatever number of licenses you chose to allow. Location permits, I should say.
Okay, so the procedure would be, this is a council meeting,
Right.
so our next committee meeting that would be appropriate committee for this would be, we have that calendar.
So, finance would be the 13th,
13th of April.
yeah.
So on the 13th of April, you would need to come back and request the council to grant another license. There was a reason that we did what we did, because we just, it got out of hand. Every place you go is a gaming parlor. I understand your situation too, because you've been in business there for a long time and all of that. My gut feeling tells me that within the next few months, there will be several licenses that will come available, but I can't guarantee that. So I think it's better if we go through the formal procedure, bring it to the council. The council will discuss it, and they'll either pass a motion to forward it on to city council. That whole process takes about a month, but if they would grant that, then you're probably looking at May. If they grant a 31st license, that you could move ahead with what you're doing. Yes, Alderman Snow.
So that being said, and I know we wouldn't necessarily want to do this, but if you're saying a couple of licenses may become available, which means somebody else closes, once that occurs, would we want to go back and put it back down to 30 or just leave it?
We could do that. You're the council. You can do whatever you want, basically, with a majority vote and going through the proper legal procedure. I mean, that's what our code is made up of, is votes by our council on ordinances, amendments, rescissions, and new ordinances. So it's possible to do that. Does that answer your question?
Yes, so in that regards, if, obviously, we don't, as a council, don't generally get notified of these, so we would rely on the administration to let us know when that occurred so that it could come up as a discussion item.
When what occurred?
When more licenses dropped off,
Yeah.
there was more availability. We're not going to know that if it's a month, 2 months, 6 months, so that we can discuss it. Not that we're going to change it from 31 if that occurs in the first
Well, with
place.
this being on our calendar now, and I think my thought would be to go ahead with the process. And then when that happens, we'll all be very aware of it because we're waiting to give that license to someone.
Good evening. My name is Maggie Westlove, and I work for Excel Entertainment. We're a terminal operator in Illinois, and we've partnered with House of Bottles for this. And I guess the challenge was that he was instructed that once he had his Illinois Gaming Board license, that you had to have that first, then move forward with it. So my concern would be, we would really like it to move forward on the April one to discuss adding, because we might be back where we are right now in the event that someone decides to give up their license, but they have that 60-day window. Then again, he's 60 days. Then on the 59th day, do they decide that someone else reopens there? He's going to be continually shuffled down the road if other people continually take those at the 11th hour.
Well, that's why I recommend.
Exactly, and I totally appreciate that. That's,
And then we always have the option, then when somebody falls off, is to reduce.
to back down to the
back
30.
so.
Yeah, no, I appreciate that.
And
So.
I'm sorry it didn't work out the way that it was intended to work out, but thank you for your patience.
Absolutely.
And we'll see you again in April.
Great, thank you very much for your
Yeah,
time.
Thanks for coming this evening.
Everyone be safe. Remember, don't tell anyone.
Okay. Next up, we have approval of minutes. Approval of minutes of the regular meeting, Belvidere City Council, of March 2nd, 2020 is presented. May I have a motion to approve? Motion by Porter, second by Snow. Questions, comments, or proposed amendments to the minutes as presented? Hearing none, all those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Arivalo.
Aye.
Brereton.
Aye.
Frank.
Aye.
Porter.
Aye.
Ratcliffe.
Aye.
Snow.
Aye.
Stevens.
Aye.
7 approved.
Looks unanimous to me. Under public hearing this evening, we have none. Under special messages and proclamations, we have a couple of guests this evening that have some good information to share with us. First up will be Amanda Mail, the current director of the Boone County Health Department. Amanda, you have the floor. Come on up.
Great. Mr. Mayor, thank you for allowing me to come and address the City Council this evening. Good evening, everyone. I'm Amanda Mail with the Boone County Health Department, and I am seriously rethinking my career in public health at this time. I'm just kidding. I love my job, and I am very pleased to serve this community and all of the local elected and appointed officials. It is my pleasure to provide some factual, with a capital F, factual information this evening regarding the 2019 novel coronavirus, or as we are referring to it now, COVID-19. What is the best way to advance the slides? Just give you okay, great. So I just want to cover a little bit about background, symptoms, and prevention. I want to give you a little bit of information on updated data that's available from the Centers for Disease Control and the Illinois Department of Public Health. And I want to let you know what your local health department is doing in response to this situation right now. I think it's really important that you all are kind of aware of what's happening locally. There's quite a bit going on behind the scenes. So just want to give you a little background to start with. Coronavirus disease, or COVID-19, is a respiratory illness that can spread from person to person. The outbreak first started in China, but cases have been identified in a growing number of other areas, including the United States. I'm also going to kind of give you a timeline. I think one of the things that's been hardest for people to wrap their brains around is that this is changing so rapidly that literally I will start an email, step away from my desk to take a phone call, and have to rework the email that I started 10 minutes ago, because that's how quickly things are changing. So on March 10th, we saw our first cases in Illinois outside of Chicago and Cook County. On March 11th, the International Health Regulations Emergency Committee of the World Health Organization declared the outbreak a pandemic. On the 12th, the health department and other regional health departments in our region recommended gatherings of 24 or more be postponed. So that was just last Thursday. Next slide. Then on March 13th, President Trump declared a national emergency, and Governor Pritzker closed schools effective the 17th, which is tomorrow. The following day, we saw our first cases in central and southern Illinois. And then on March 15th, we saw our first cases in the northern Illinois region. We do have one confirmed case in Winnebago. And then Governor Pritzker yesterday in his address limited restaurant and bar operations effective today. So needless to say, we have been extremely busy trying to keep up with all of the changes. So again, let's do some fact checking and some myth busting. So how does COVID-19 spread? It is spread mainly from person to person between people who are in close contact with one another. So when we say close contact, we mean within 6 feet of each other for more than 10 minutes. So again, close contact is within 6 feet of each other for more than 10 minutes. So technically right now in this meeting, we're kind of sort of in close contact. So I know that that's something that we're working very closely with a lot of our boards to figure out what might be maybe some safer practices going forward. But again, the situation is changing so rapidly that it is extremely hard to keep up, right? So people are thought to be most contagious when they are most symptomatic. and some spread might be possible before symptoms show, but this is not thought to be the main way that the virus spreads. There's a lot about this virus that we still don't know yet because it is a novel or new strain. So it's part of the MERS and SARS family of viruses, but because it's a new strain, it's behaving a little bit differently. And we're really trying to wrap our brains and minds around exactly what's happening with it. And it may even be changing as it spreads across the world and evolving, because viruses do that. They're smart. They get in people's bodies and then they go from one person to the next person, and they get a little smarter about how to infect the next person. So we do see that. So let's talk about the symptoms just to make sure that we're really clear on what those symptoms are. So the symptoms are fever and what we call lower respiratory symptoms. So lower respiratory symptoms are a cough and shortness of breath. So again, the symptoms are fever and then lower respiratory symptoms of a cough and a shortness of breath. So these symptoms may occur with this virus from everything that we have been able to figure out so far between 2 to 14 days after exposure. Here's a piece of information that I really want to stress to all of you if you can help get this message out to the public. If someone is experiencing fever, cough, and shortness of breath, stay home. Don't go to a clinic, don't go to the ER at this point. Stay home and call your healthcare provider before going to a facility. Then inform them of your symptoms and they will direct you further. So what we want to make sure that we do is that we keep our frontline personnel as safe as possible. So that's our first responders, our police, our EMS, our fire, our clinic workers, our healthcare workers, our emergency docs. If somebody walks in and exposes a whole waiting room or an entire EMS crew without us knowing, then we have more of a risk of losing our first responders, and we need them more than ever right now. All right. So prevention. One of the reasons that this is a little unnerving at this moment is that we don't have a vaccine. So for those of you that remember when we dealt with H1N1, or what was sometimes called swine flu, we did end up with an effective vaccine, and we were able to push that vaccine out. So with this, we don't have a vaccine available and ready yet, and it's going to take a while longer to have that ready. And so really the only way to prevent that spread is to limit close contact and practice what we call social distancing. And in just a few slides, I'm going to clarify exactly what I mean by social distancing, so that if you're getting questions from people like, I don't understand, the health department's telling me to do this or that, or I read this on the news, if you all can really help us to push those factual messages out, that would be extremely helpful. So the best way to prevent illness is to avoid being exposed to the virus. And during the COVID-19 outbreak, stay home as much as possible. Be mindful of those who are at greater risk for contracting the virus, including older adults and those with underlying health conditions. Next slide. So I think one of the most interesting things about this virus is that, and this is lucky for us, we're not seeing it as much in children, which is excellent, right? So that generally tends to be one of our more vulnerable populations. Now that could change as this virus gets smarter. But we have not seen as many cases amongst youth, and we're not seeing critical symptoms. What we are seeing are that our folks that are most at risk right now for this virus are older adults and people who have serious chronic medical conditions. So that would be like heart disease, diabetes, and lung disease. So if you're at higher risk of getting very sick from COVID-19, you should do the following. Stock up on supplies, take everyday precautions to keep space between yourself and others. When you go out in public, keep away from others who are sick, limit close contact, and wash your hands often, and avoid crowds as much as possible. So we have some really good messaging available for download and emailing out or putting on social media, getting it out to your friends and family and your constituents regarding cough etiquette. I know some of these things sound like kind of kindergarten or preschool information, but I just can't believe the number of people that I see out in public that cough like this into their hand, then they shake somebody's hand, right? We want to cough like this into our sleeve and make sure that we're not just rubbing our hands full of virus and then shaking the next person's hand. So we try to really push that messaging out. Next slide. So washing your hands, you can sing a song like ABCs or Twinkle Twinkle Little Star. That's about 30 seconds. You want to scrub vigorously. I know a lot of healthcare professionals that don't wash their hands sufficiently. How many people at the fire department and the police department wash their hands adequately? Probably not everybody all the time, we won't pick on anybody in particular, but we really, really, really want to push the messaging out about how to wash your hands and how important it is to do that, because good old soap and water will actually not only kill this virus off your hands, but keep you from spreading it to somebody else. Next slide. And we've covered most of these points already, so we'll move to the next slide. With seasonal flu, we see thousands of deaths every year, but we do have a vaccine, and we also have antiviral treatment available. So Tamiflu and other products are available for healthcare providers to provide out to the community when they become infected with seasonal flu. We don't have that for COVID-19, so that's another reason why really the social distancing and separation is our only successful strategy at this time. People with COVID-19 should receive supportive care and to help relieve their symptoms. And then for severe cases, treatment should include care to support vital organ functions. So unfortunately, we have had deaths now in the United States due to COVID-19, and as many of you have probably heard on the news, we have other countries around the world that are experiencing thousands of deaths, right? So really want to keep that from becoming a reality here in the United States if we can. So just a real quick situational update. I'm going to get a little nerdy with some numbers, but I really just want to help you to understand the impact of how quickly this is moving and spreading. So if we look at what's happening in the United States right now, as of today, we have 3,487 cases. We have 68 deaths. And the states that are now reporting cases are 49 states. We also have 2 territories that are reporting cases. We have some travel-related, some close contact, and we have a bunch of cases that are still under investigation pending the lab results. So then we did have 3 individuals who were repatriated back from Wuhan, China, some officials and diplomats that came back that were evacuated back, that were quarantined at naval air bases across the country. We did end up with 3 cases from that, and I know that many of you probably heard some of the terrible news about the Diamond Princess cruise ship. There were 46 cases just from that cruise ship alone. So actually just today we did get some additional guidance on people who are considering a riverboat cruise or a cruise on the ocean right now. We're basically just telling people that's really not a good idea. So don't take a cruise, cancel your cruise plans, postpone your cruise plans, because that seems to be a very, very, very rapid spread location for this virus at this time. Okay, next slide. So this is the slide that I presented at another board meeting on the 4th of March. And it's hard to probably read for all of you, but the reported cases, the little key in the corner, basically there were 3 categories. No cases, 1 to 5, and then 20 to 30. And as you can see, we had a handful of states, including Illinois, that were starting to turn colors on the map. Now let's flip to the next stage. This is today. So we have many more categories. We have categories that go from 501 cases all the way up to 1,000. So California has been hit really, really hard. Washington State's been hit really, really hard. New York's been hit really, really hard. And we're one of the darkest colored states in kind of our immediate Midwestern region. So we have now, if you want to flip to the next slide, as of today, we have 93 cases in the state of Illinois. Just a few weeks ago, it was like 15 or 20. And then total persons under investigation is 1025. So those would be people who are perhaps being isolated or quarantined in their homes. The local health department where they reside is monitoring their symptoms. They aren't allowed to go out right now because we're concerned that they have been exposed, and we're concerned that they may pass that to other people. Next slide. Okay, so my message at all the meetings that I've been presenting at, it continues to be the same. We're preparing and we're not panicking. It's really, really important that we prepare and that we don't panic, and that we practice our 3 C's. So that's cover our cough correctly, right? Contain the illness, so stay home, right? And then clean our hands vigorously with soap and water, rubbing really hard for about 30 seconds. Again, sounds like a kindergarten classroom spiel, but it's really important for the whole community to be clear on that. So we have definitely moved from prevention as a community, as our overall strategy, to what we call community mitigation. So that was a big shift that we've seen just in the last week to 10 days. And when I say community mitigation, what I mean is a set of actions that persons and communities can take to help slow the spread of respiratory virus infections. Since there is currently no vaccine or treatment available at this time, we feel this is an appropriate and measured response to prevent and contain further spread of COVID-19 in the community. I don't have a crystal ball, but I do know that we're seeing community transmission here in our region. We have cases in Winnebago, or we have a case in Winnebago. We have cases in McHenry County. Do I think that the virus is here in Boone County? Most likely, yes. Have we identified it in an individual yet? No. But I just want to prepare everybody so that you are aware that I do anticipate that we will see it here in our very own community. Important to be aware and ready for that, right? So social distancing is a term applied to certain actions that are taken by public health officials to stop or slow down the spread of a highly contagious disease. So that would be the series of recommendations that we've been talking about during this presentation. So limiting public gatherings of 25 or more, closing down the schools, right, for this 2-week period, limiting bar and restaurant operations, doing things like that that really kind of force people to do that social distancing and give those guidance so that they can make smart choices. And then we talked a little bit about close contact. Does anybody remember what it's up there, never mind. I was gonna quiz you, but we'll go ahead and go over it again. That's okay. Being within 6 feet for 10 minutes or more. No problem. All right, next slide. So just some other factual information to provide. Is there a mask shortage? Do we have a shortage of PPE? Yes, as a nation we are running low on masks and we are running low on PPE. One of the issues is that some of the countries that are most heavily affected by this virus are some of our major worldwide distributors of all of our PPE, right? So this globally affects all of us when it's hard to place a 3M order and have it, being manufactured in a large Chinese factory. And they are so hard hit right now by this global pandemic that they've had to shut down major operations. So one of the good pieces of information that we were able to get cleared through the FDA on March 2nd is that they lifted the restrictions for expiration dates on some of the current PPE that we have stocked on our shelves that was originally expired, but they extended out those expiration dates so that we can use those products that will allow for some protection and that will assist in trying to mitigate this. Next slide. So to mask or not to mask, this is another thing that I'm hearing. I have done a little bit of traveling recently, and I have seen a lot of people in airports wearing masks. I've seen a lot of people kind of out in public wearing masks. Really what's being recommended right now is that the only people that need to be wearing a mask if they go out in public are people who have a cough or are ill. Now those people should be staying home, but if for any reason they're out, like if they've been advised by their doctor to arrive at a clinic, maybe go through the back door of the emergency room, which is some of the ways that some of the hospitals are handling this, right? What we don't want is the worried well or just the general American public to be running out to the store or placing online orders for masks that we need for our first responders and we need for our healthcare professionals right now. Next slide. Okay, and what about the test kits? I know there's been a lot of conversation about this on social media. There's been a lot of conversation about this on the news. Different countries authorized different test kits, and the test kits are not the products that the providers are using in the clinics to do the swab. The test kits are the kits that the laboratories need to actually run the test to detect the virus. Different countries authorize different forms of tests to be used. The United States made a choice that was different than what maybe other countries in the world did. So when you're hearing that there are like mass drive-through testing facilities in other countries, that's because those governments have made different choices about what types of testing laboratory products they're using. So I just want to make sure that that is clear too, because that information has been a little bit misconstrued. Next slide. Where can I get credible information? My neighbor's Facebook page, my friend at the grocery store, Mayor Mike. No, I'm just kidding. Just kidding, no. CDC, IDPH, Boone County Health Department. Please use credible sources if you're referring people to information regarding this situation, because we're really trying to push out a clear, consistent, concise message. Next slide. Should I travel? This question is changing by the hour. So the picture that is the map of the world and all the little yellow and orange dots is a typical Tuesday morning at about 10 a.m. of how many airplanes are in the air. So basically, we would say that within 36 hours, an illness that starts in, let's say, a remote village in northwestern Africa could spread to 6 continents within that 36-hour time period. So communicable diseases travel 650 miles per hour in the air, and how fast do people drive on the highway, Chief? 90, 95, right? So an illness can travel in a car 90, 95 miles per hour, depending on how fast over the speed limit somebody is going. And so we see this with other communicable diseases, whether it's tuberculosis, whether it's measles, other airborne illnesses that we might be concerned about. And right now we're incredibly concerned to hear about long airport lines, and people are still making trips. And so there is a link to the CDC travel advisory website specifically for COVID-19, and this gives the risk level criteria for all the countries in the world that have a level 1, 2, 3, or 4 risk level, and it explains on that website exactly what they mean. So sometimes they're going to say limited travel, essential travel only, absolutely no travel, and that can help to clarify for the public or your constituents if they're wondering about travel. And then just today, we just pushed out the information about the new guidance released on cruise ships and riverboat cruises, which is just don't do it right now, is basically what the memo says. Next slide. All right, so we're going to skip the next 2 slides because I've covered most of this. All right, now stay there. I'm going to quiz everybody. So does anybody know the difference between isolation and quarantine? Because there is a difference, and those words do get used interchangeably. Yes, but you can have a voluntary or an involuntary isolation or quarantine. Anybody else?
Pretty much so nobody going near you, except medical personnel maybe.
Okay.
Isolation, one person, quarantine, the whole household.
You guys, these are great guesses. Nobody's quite right yet, but I really appreciate you guys taking a stab at it. So let's talk about quarantine. Next slide. Okay. So quarantine is the separation and restriction of movement of well persons presumed to have been exposed to a contagion. Okay, so we might tell somebody that they have to stay home and be quarantined because we know that they were exposed directly to an infectious agent, and they might be incubating the virus in their system but not showing symptoms, so we really need them to, as a precautionary measure, stay home. Versus isolation, which is the separation and restricted movement of ill persons. So the way that I remember it is isolation ill, like I, right? So isolation is for ill folks. So everybody with COVID-19 that has been isolated in the hospital, there are extra precautions being taken, but we have thousands of people across the country right now that are in quarantine in their homes that are really not allowed to leave because we're monitoring their symptoms to make sure that they're not going to develop the virus. Next slide. Okay, so actually within our state statute, the health department may order persons isolated or quarantined, order places closed, order physical examinations or tests, order administration of vaccines or tests, order observation and monitoring, or have emergency access to medical information. And then obviously we must release as soon as reasonably possible, so we don't put these restrictions on people just kind of when we feel like it. We do it when we feel that there is a legitimate public health and public safety threat to our community. So it's that balance between individual rights and responsibilities and then what's for the public good. Next slide. Okay. So again, some additional messaging that I think is really important for us to push out to the public right now. Stay calm. You are not alone in this, and your community is here to support you. Talk to your friends and family and let them know if you're having concerns. Stay apart. Keep at least 6 feet away from others, including while shopping. Avoid the lines by taking advantage of pickup and delivery services for groceries and other goods, and stay put. Keep non-essential trips to a minimum and reconsider your travel plans. Continue staying home. Questions? Yes.
I heard that masks only do good, they won't keep you from getting the virus, they only are for, like you say, people that have it. Is that true, that you can wear a mask and still get the virus through the mask?
Depending on the virus, yes, that is true, depending on the type of mask, right? So there's thousands of different types of masks out there. Also, with our first responders and our health department and health care employees, many of us have been what we call fit tested, which means that there's actually a machine that tests the shape of our face and against different masks, almost like getting fitted for a running shoe, where if I'm wearing the wrong mask, or if Chief Woody's got the wrong mask on, it's not necessarily going to protect him from the virus if he goes out on a call, right? So there's a variability there. Yes.
My wife works for an attorney who's a very big animal advocate and works with Noah's Ark. Noah's Ark is having people dumping pets because they're afraid that they'll get the virus from the pets or give it to the pets. I know that sounds ignorant, but it's happening.
I'm not specifically aware of any state or federal guidance in relationship to being concerned about pets. Viruses can travel from animals to humans, oftentimes through like a bite, right, when we think of something like rabies. But I'm not aware of any reason why we would be recommending that people do that at this time, or encouraging people to do that.
For some reason, people are doing it.
Yeah. Yes.
What would you recommend for somebody that has cancer, that's going through cancer treatments? My sister has to go to the hospital like quite often for cancer treatments, and that she's immune depressed.
Yep.
So that's risky.
Yep. So she would be in that high-risk category for this virus. So she would really, really, really want to practice social distancing as much as possible. I'm assuming that her, cancer facility where she goes for treatments is well aware of this situation and taking those adequate precautions. She, would want to call ahead and make sure that those precautions are in place. She needs to be very, very careful at this time.
Well, she goes to the cancer center, so almost all of them are in that same boat.
Sure. So they're going to be putting added measures into place. So cancer centers, another example of locations where very, very, very stringent policies have been put into place, are our long-term care facilities and our nursing homes, because we've seen now with the state of Washington, unfortunately, that they did have that outbreak in one of their facilities, and it has taken the lives of so many of our elderly and vulnerable residents, unfortunately, as a result. So, yeah. Yes.
What's the incubation period? Like, what's can be contagious? Is it active still maybe 1 day to 10 days?
2 to 14 is what we think. That's been our most educated, based in science guess that we've been able to come up with as the world has put their heads together on this. Yes.
You have a question, Jeff?
Please.
Sure.
Amanda, let's say I have influenza A. Would any of the influenzas morph into corona?
No, that's a good question. I've heard some questions about viruses changing, but in this particular case, these are 2 separate families of viruses. Yeah. Did you, Mayor, anything else you wanted me to cover?
I just wanted to thank you. Since last Thursday, we've been on daily conference calls, and they've been pushing out information as they get that and are allowed to release it. And that's what we will continue to do from here on in with the city. We will upload to Channel 20 recommendations and publications that are on the letterhead, either from the state or the health department. And unless it's on that letterhead, we're not going to put it up there. So we will try to eliminate the chatter of non-exact information going on from our perspective as well.
That's Great, yep. I think we should be prepared as a community to, for this to go on quite a bit longer than the current sort of 2-week restrictions that have been put into place. I feel like I should just be really honest with you all and tell you that I see this being more of a marathon and not a sprint. I know there have been some initial 2-week precautions put into place to encourage social distancing, but I really think that we're all kind of in this for the long haul. I think that there are a lot of unidentified cases out there that we're working as quickly as we can to identify. And your local health department is working around the clock on this. We've been putting in 13 to 15-hour days and working on the weekends, and we will continue to do everything we can to work with our local first responders and the governmental system to protect the 54,000 people that live in this county, including obviously the city of Belvidere. We want to keep people safe. That is one of our primary roles as public health. So we'll do everything we can for you. That's all I can say. So
Thanks for coming tonight.
yeah, thank you. Thanks.
There is a hotline number that was released today from the governor's office, IDPH, that you can call and ask questions. That will go up on 20. We're putting the materials together starting tomorrow to try to keep those as current as possible. But you can see from last Thursday till now, wow. It's like every 4 hours there's different information going on. So next up this evening, we have a presentation by Pam Pettis from Growth Dimensions. Pam, you want to come up?
Thank you. I want to thank you guys for inviting me today to speak with you. Appreciate your support for the past year. I want to share with you what Growth Dimensions has been up to for the past, actually since October, since we spoke with you last. A lot of people think that our focus has been primarily being the marketing arm of Boone County. That is a large part of what we do, but we do more than market Boone County. In our 2020 vision, we're trying to outline this a little bit clearer. We're trying to align our strategic vision with our work, align it with our plans, with your plans such as the comp plans that are available, the SEDS plans, the workforce development plans for the region. We're also trying to focus what our strategies are with what our targets are and where our resources need to go. So marketing Boone County is a big part of our strategic plan. Also developing infrastructure in our community, connecting businesses with resources, and to sustain economic development. So I'm just going to highlight some of the things that we've been focused on over these past few months, actually the past year. So business engagement is a huge thing of what we do. We need to understand, in order for us to market, we need to understand what our competitive edge is. We need to know what our community is, makes us unique, makes us special in comparison to other regions. One of the things that we're doing is we're reaching out to companies, we're visiting them, we're trying to identify what they need to do to sustain and to grow. We heard about the virus, and it's really affecting everybody, and it's affecting our economy. Over the past few weeks, we've been listening a lot on how what's happened in China is affecting our automotive industry. So we've been listening to what the issues are with the timelines, what solutions they're trying to develop for the future, what's their pipeline. And you may or may not be aware of this, but a lot of our automotive materials come to and from China and Mexico multiple times before they're put on a vehicle. So they're talking about what are they going to do for the long range, how this is going to, the length of time it's going to be before they get shipped their materials. Again, how this is going to affect our economy in general. So measuring that economic impact, it's not only a positive thing that we measure the positive impact, but we also measure the negative impact. What we're doing in response to this recent crisis is that we're going to be surveying businesses, identifying what the issues that they have currently, where did they think they anticipate being, and what actually happens as time goes on. We want to be ready for and to respond and to help them, so we have as little interruption in future growth. So this has been a big issue for everybody, and understanding how this is impacting our business and our community is going to be critical. we want to be ahead of the game. So one of the other things that we do is we've been leveraging resources to attract, retain, and grow our businesses. We look for resources that could help respond to the needs of our business. Right now, we've had some grants that we've been looking at for redevelopment, for cyber technology, and others to reduce the strain on businesses and our government. One of the areas that we're trying to develop is our entrepreneurial ecosystem. We have a number of businesses that come to us looking for help, looking for support. We're very fortunate that we have a number of businesses that are very passionate. They come to our community because they're passionate what they do, and they build a business here. But sometimes they don't have the full picture of how they can, what they need to do in order to sustain themselves and to grow. A lot of those issues run into financial, how do they financially sustain, how do they market, is their building sufficient to what their needs are the codes sufficient to what they need? So we work with these businesses in order to respond to that. Well, over the past year, we've been working with developing this ecosystem to establish new businesses, to sustain businesses in the community, and to help them grow. And the Kauffman Foundation has committed $20,000 to implement two cohorts of fast-track training. This will be a model that we'll be able to implement in our community in order to help these businesses with these resources that they need. This will be brought forward to the council in the next couple of weeks. Because this does go to the Kauffman's Foundation is their primary mission is to help small communities grow. One of the other projects that we've been working on is with our education systems and our workforce systems on career pathways and readiness. We started this conversation a few years back with the education system, District 100 in our community. There was a number of our businesses that were saying that we're not getting the workforce that we need, even though they have high school diplomas. So how can we do that? So they asked us to help pull together industries and have that conversation with them, identify skills that they feel is essential in order to build that workforce. So we've been working with them throughout the years in order to develop this pathway, and they've developed a new type of training with the competency-based learning opportunities. We're also working with the Workforce Connection. I actually chair a Pathways Committee and trying to develop these resources for adult learners. And then we're also working with the Women's Today's Manufacturing on a Pathways Initiative as well. So there's a number of engagements that we do outside of our community in order to respond to the needs of the workforce needs of businesses today and tomorrow. So one of the things I think that more people are more familiar with the growth dimensions is that we're building our identity or our visibility in our community, not just for our organization, but for our community. One is branding our identity. It's more than changing our logo. We've actually been increasing our social media presence on Facebook, LinkedIn, and Instagram, and we've actually have a new website that we redesigned in end of 2019, and our opportunities through these systems is to create some very clear and targeted message. The targeted messages that we send out is different from somebody that will send out in the community to businesses that we're working with than somebody that we're trying to engage outside the community. So what they're looking for and what is important to them is very different, and understanding those features that we evaluate all the time, and we try to, again, target those messages. We measure, there's a couple of different measurements that we look at. We look at our capital investments that has been part of the community, what comes in, what do companies invest when they build here. So there's been almost $600 million in investments, about 4,400 jobs that have been created, over 700,000 square feet of real estate. In the past couple of years, Growth Dimensions have had 1,700 new contacts. Now remember, we've had a staff of 2, and we've had 17 new contacts, and our goal is to create those contacts and turn them into relationships, because we know that that's what's important to Boone County and Belvidere. We've had 27 major projects that we submitted last year. This year alone, we've already submitted 15. We're getting a lot of attention toward our area. 2 of those projects I've been working on are in what we call phase 2, which means that they want more additional information in order to, because they're furthered interest in our area. So submitting a project takes a lot of coordination, collaboration to a lot of, the departments in and out of this office. It takes a lot of research. The questions that we have to respond to range from, give me how much it's going to cost me in my taxes for the next 10 years. What are your facility costs, your labor costs? It could be how close is the nearest soybean farm and how much do they produce? The detail varies from project to project. And typically, we have from 24 hours for the short-term projects. They're looking for us to respond to them in 24 hours. And other times, we have a week. So it gives us a very short turnaround to engage different departments, different companies. We have to contact ComEd, NICOR, it might be Comcast, for different features to get this information. Many times we get those projects on a Friday afternoon, and we have to work through the weekend and through the next week in order to get these accomplished. But that's something that our hours are based on what the business's needs are. So these projects take a lot of time in order to engage. And one of the projects that people know that we work on quite a bit is our enterprise zone. So we've been doing a lot of things like, presenting to more groups, door-to-door engagement with businesses, putting more information on our website in order to, and responding to those project requests. We actually put the information that we have in English and Spanish, and we're doing more advertising. So managing enterprise program on behalf of the taxing bodies in Boone County is one of our functions of growth dimensions. We get a number of referrals from economic development, planning, building, real estate, financial, lawyers sometimes, attorneys, small business development centers. But we've had 21 businesses in 2019 that we worked with for the enterprise zone projects. That may not sound like a lot, but let me put that in different terms. 81% of those, by the way, those businesses are from Belvidere. In 2019, those 21 businesses were actually 38 projects. I look at it this way. You're building a house. That's a business. Then you're working on your kitchen, which is a project. So we had 38 projects. And then within that project, you have a number of individual jobs. We had 386 jobs last year. That means, if you can go to the next slide, for each of those 386 jobs, we have 9 different steps and functions that we have to work with each one of those projects. These come from reporting to the state, filling out the applications, marketing, helping provide them with information and resources, following up, closing projects, opening up projects. So it's quite extensive, the process. And let's say we take about an hour each person, so or each job that we have. That's about 3,500 hours that we spend in a year last year just to work on that. That's more than a full-time person. And I had 2 people last year. So this is quite extensive, the Enterprise Zone program. In the, go ahead and click again. Go ahead and click it again. Thank you. Oops, no, you're missing a thing back. Oops, we're missing one of our things disappeared. Go ahead, go next one. Oh, well, it disappeared, I'm sorry. But the Enterprise Zone program estimated cost us about $80,000 to implement for the work that we did last year. We do get some administration fees that we charge the businesses in order to implement it, and it's the maximum percentage that's allowed by the state. But even so, we're not looking to make money on this. Really, the focus of this is to implement a premier program. The majority of those resources are spent just to kind of give you an idea on project management for the program, followed by marketing. Okay. So we were fortunate enough that in this past year, we were able to add to our team. So we actually have 2 new team members. My administrative assistant actually moved on to be the executive director to the Belvidere Area Chamber of Commerce. So we, since October, actually in November, I hired 2 new individuals. We created a new position because, as I mentioned, we had 1,700 people that we reached out to in the last couple of years, and turning those people into, those contacts into relationships is where I need some help. And so Heather Wick joined us as our business enterprise manager, and she specializes in a lot of marketing and business engagement. Kim is our new administrative assistant, just started with us a couple weeks ago. And, you know, just to kind of give you an idea, like I said, you know, our commitment is to this, you know, to our community. We're very passionate about what we do. Between Heather and I, we've served in 20 committees outside of Growth Dimensions, outside of our regular functions. Our average work week is 60-plus hours, 60, 70 hours. I was here on the weekend. I know that somebody picks up their packet every weekend because you see the notes on the door, or you set the alarm by accident. I'm here. But, you know, so, you know, our focus, again, it's not about putting in hours. It's really about getting what we need to get accomplished done. And, you know, a lot of what I really want you to see, and I know that people are questioning whether or not economic development is really a good investment, but I want you to picture what this community would look like without economic development. It will be, you know, it will be kind of scary. It really does scare me, because it would be your inability to attract new businesses. And not only that, but I believe that the businesses that we do have will leave. And I can give you a lot of reasons why that should happen, but most of it is that it sends a very clear message to our businesses that they're not important. What we do is very important to our businesses, and not only to help them stay here, but help them grow. And do we hit every business? Probably not. But we do hit a number of businesses. I feel like we have a lot of credibility in the community. I believe that what we've done has been showed some good value. Go ahead. So what I'd like to see is the other thing that might happen is that others surrounding Belvidere, Boone County, will see what your greatest assets are. Our community has some great assets, great opportunities. And these communities know that. And they would love the opportunity to use their priorities and take the assets that you have for their benefit. And they won't look into your priorities or consider what, you know, value you have to add. They will focus on what they want to see happen here. And so, you know, I think it's very important that you be aware of the challenges that we have while we work together with our regional partners across, you know, the northern Illinois area. We do understand that we do Growth Dimensions. Our goal is to make sure that your best interests are at the table. Next one. So I want to thank you all. And again, like I said, I think we have your best interests in mind. We're very passionate about the community, and we're committed to helping build a better community for you. Thank you very much. Appreciate your time. You have any questions for me?
Could you give us a brief explanation exactly what an enterprise zone does or doesn't do for somebody?
Okay, enterprise zone helps offset dollars for a business that is interested in building or growing their footprint. For instance, and there's a list of things that are eligible. So the elected, the taxing bodies identified locations within Belvidere, Capron, and Poplar Grove in which they'd like to see development. So this is businesses that are in that enterprise zone or looking to come to that enterprise zone may get building permit fees at half price. For any increase in value to their property, they may, which results in an increase in property taxes, they will get a property tax abatement. The first year, they would get a discount at 80%, second year, full year, 60%, third full year, 40%, and 20%, and then they would they pay the full amount. The last benefit, local benefit, is that they would get sales tax exemption. So if they were to buy building materials in here or in Illinois, they would get their sales tax waived. This entices a lot of those businesses to participate in the enterprise zone.
Can you tell us, without giving us the names of some of the businesses that maybe would be coming to Belvidere?
We can give them by project name. A lot of times, gosh.
An idea of what we may have.
Oh, the types of companies. So one is a food processor company that is interested. That's one we're in phase 2. Another one that we are in phase 2 is a company that, I apologize. We deal with so many at various sizes. It's our most recent one. No. Data center, we were actually working, we were almost like it's phase 3, 4 with the data center, but we couldn't get them what they need within the time frame that they wanted, so this was a data center, data. Doesn't mean a lot of employees, but it does mean a lot of resources that come into the community.
Have you heard anybody that was interested in a daycare that was up by Pacemaker? That they built and then they ran out of money, that there might be a buyer or somebody interested in that?
Yeah, we've actually dealt with 3 of them, I think, the past couple of years.
Yep. That'll be actually on your agenda in May.
Mm-hmm. So, yes, we do work with all size businesses. For every large manufacturing business, it brings in so many other jobs into the area. But we also work with spurring development for our small businesses and trying to encourage them to grow, trying to give them the resources they need to grow or sustain that footprint. That's why we're developing this ecosystem in order to help our small businesses, our homegrown entrepreneurs. Any other questions?
This is the most I've seen from you in 3 years. The mayor says you're in here every quarter. I don't remember it. Last time I seen you were in here giving out plaques. The guy before you, I think Mark Williams it was here like once a month. Let us know what's going on. This is the first time in 2 to 3 years I've seen you.
I was here in October of 2019.
I remember giving out plaques or whatever.
I don't know if I was. I don't think I was. I think I actually did a report. But would be glad to. Quite honestly, being short-staffed,
I said the last
I'm
time
limited.
that I would bring in the budget that we take the money away from you. And I'm still thinking highly about it because I told you 3 years ago you need to at least tell us. I mean, you may tell the mayor, but it never seeps down to us in the slightest bit.
Okay. We can put it on a monthly basis. We have 4 taxing bodies that we receive investments from. We do go to Boone County. We've probably been there 6 times last year, maybe a couple more, maybe had staffed a couple more. Belvidere, City Belvidere is the second one we probably visit the most. And the others, we maybe have been in once a year, maybe once every 2 years. So, and I understand that. We have about 40 investors, and it's, a challenge for us. We try to be, where we need to be, and we can put us on the agenda once a month. I know you guys have had a full schedule as well. You've had a pretty hefty load over these past several months, and we'll try to make that a priority then for you. If we have it scheduled once a month, if we don't have one, maybe we can send a report to be read to us.
That'd be even
That'd
nice.
be good?
Just to, this is the most I've seen in 3 years, so.
or you're wrong, but that's you. So the reality of it is this. If you look at who the board of directors, large board, executive board, are that support growth dimensions, it's the who's who of the leading businesses in the community, period. The effective use of economic development is business attraction, business retention, and building the awareness of the community on not only a statewide, but a nationwide. We're in competition with everybody all the time. It was not an accident. And, you know, honestly, I've had 3 different directors of Growth Dimensions since I became the mayor. And this is the first time that we have taken a very systematic approach and been able to build on from one year to the next year, doing the outreach programs that were done. If you remember, at one time in the past, when Mark was our director of Growth Dimensions, they had 5 people in an office down in the post office. It ended up being just Mark. And to his credit, he was offered a job at the city of Rockford at a much higher salary than we could pay with Growth Dimensions. And so he's been an economic development director inside the Rockford government. If you want to get a read on how Pam is respected in the region, call and talk to Mark and see what he has to say, and then come back and share that with us, because I'd be interested in that myself. So thank you, Pam.
Thank you, and thank you very much for your time. I appreciate your support.
Okay. So next up, we have approval of our expenditures for the month. First up is general and special fund expenditures of $1,263,419.18. I'll entertain a motion to approve. Motion by Alderman Snow, second by Alderman Ratcliffe. Questions, comments concerning any of the expenditures presented? Hearing none, all those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Brereton,
Aye.
Frank,
Aye.
Porter,
Aye.
Ratcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
7 in favor.
It's unanimous. Next up, we have water and sewer fund expenditures in the amounts of $760,240.45. I'll entertain a motion to approve. Motion by Alderman Arivalo, second by Alderman Ratcliffe. Questions, comments, or further discussion concerning any of the expenditures presented? Hearing none, all those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Frank,
Aye.
Porter,
Aye.
Ratcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
7 in favor.
It's unanimous. Next up, under committee reports and minutes of our city officers, I noticed that items A through G have been received and placed on file, which brings us to item H, minutes of the Committee of the Whole, Building, Planning and Zoning, and Public Works of March 9th, 2020. I have a motion to approve. A motion, Snow, second. From Alderman Porter. Questions, comments, or proposed amendments to the minutes as presented? Hearing none, all those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Porter,
Aye.
Ratcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
Frank,
Aye.
7 in favor.
Minutes are approved unanimously. Takes us to item 9. The first item is actually a two-parter. First of all, I need a motion to approve, removing from the table to the motion to approve city attorney drafting an ordinance for gas use tax and an agreement with NICOR to collect the tax. Motion by Porter, second by Frank. Questions or comments? You had a question? Okay. All those in favor of approval of taking this off the table will, when your name is called, signify by saying aye. Those opposed, nay.
Ratcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
Frank,
Aye. Aye.
Porter,
Aye.
7 in favor.
Motion is off the table. The second part is a vote. I'll need a motion and a second to have the city attorney draft the ordinance.
You previously had a motion and a second from the last time this board council.
Okay, so this is our second time around on this. A motion to approve.
Already have it, Mr. Mayor.
Motion and a second. All those in favor? Will, when your name is called, signify by saying aye. Those opposed, nay.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
No.
Frank,
Aye.
Porter,
Aye.
Ratcliffe,
Aye.
6 in favor.
Motion is approved. Under B, we have ordinance 485, H, the second reading, an ordinance amending section 9812 of the City of Belvidere Municipal Code, the Sidewalk Cafe ordinance. May I have a motion to approve? Motion by Ratcliffe, second by Arivalo. Questions, comments, or further discussion concerning the motion on the floor? Yes, sir.
Mr. Mayor, with respect to this one, it came to committee, I believe it was last week, there was discussion about changing the hours of operation to allow sidewalk cafes in general to be open 1 hour later, but also to add additional language restricting the sidewalk cafes to businesses that also operate as a restaurant. In your packets this evening was a amendment to the sidewalk cafe text incorporating those two changes. So if the council wishes to incorporate those two changes into the ordinance which is before the council, it'd be appropriate to make a motion to amend the ordinance as set forth in the document provided by the city attorney.
Motion to amend. Snow, second. Porter, questions or comments? Hearing none, all those in favor of the amendment, vote when your name is called, signify by saying aye. Those opposed, no.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
Frank,
Aye.
Porter,
Aye.
Ratcliffe,
Aye.
Snow,
Aye.
7 in favor.
So the motion is amended. What else do you need from this?
Any discussion and then a motion or an approval vote on the ordinance.
Any further discussion? Yes, Alderman Porter.
Well, I was just going to say that I was initially against this based on just being alcohol sales for the most part, but now that there's food included, I'm willing to give it a try here.
Anyone else? Somebody the apple? Yes, Alderman Frank.
Are these just going to be on Buchanan, or are there other ones?
No, it'd be anybody who meets the qualification where the sidewalk is large enough to entertain one with all the other stipulations of the ordinance.
There are some other locations along State Street where the sidewalk is large enough to have your full 4-foot ADA clearance and then adequate space for the seating. So yeah, it would be in other places downtown.
Okay. Who buys the table and chairs, though? Property owners?
Yes. Wendy buys the table and chair. No, it would be, it's their responsibility, of course. Any other questions or comments? Hearing none, all those in favor of approval of amending the ordinance as described, will, when your name is called, signify by saying aye. Those opposed, nay.
Arivalo,
Aye.
Brereton,
Aye.
Frank,
Aye.
Porter,
Aye.
Ratcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
7 in favor.
It's unanimous. Thank you. Under new business this evening, we have three ordinances.
Did we vote on the amended ordinance?
Yeah, that's what I just said.
I misheard
We
you.
voted 3 times on the same
I
thing.
misunderstood what you said then.
Okay. Under new business, we have 3 ordinances that are first reading. Typically, these are silent ordinances. We do not discuss or vote, but for the benefit of the folks at home, I will read through what they are. Ordinance 486H is an ordinance budgeting for all corporate purposes for the city of Belvidere, Boone County, Illinois, for the fiscal year beginning May 1, 2020, and ending May 1st, 2021. Ordinance 487H is first reading, an ordinance amending section 110-92, yield intersections of the City of Belvidere Municipal Code to add Garfield Avenue at West 3rd Street as a 2-way yield. And then ordinance 488H, first reading, an ordinance amending 106 of the City of Belvidere Municipal Code to add a new Article 10, municipal gas use tax, and authorizing a collection agreement with Nicor Gas Company. Which then takes us to Resolution 2108-2020, a resolution authorizing the execution of an agreement between the City of Belvidere and As of Our Audit Solutions, Inc. May I have a motion to approve the resolution? Motion by Snow, second by Radcliffe. Questions or comments? Further discussion concerning the resolution now on the floor. Hearing none, all those in favor will, when your name is called, signify by saying aye. Those opposed, nay.
Brereton,
No.
Frank,
Aye.
Porter,
Aye.
Radcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
6 in favor.
Resolution is passed, which brings us to Resolution 2109 of 2020. Resolution authorizing the execution of an agreement between the City of Belvidere and Tyler Technologies for implementation of a cloud-based financial system. May I have a motion to approve this resolution? Alderman Arivalo and Alderman Radcliffe. Questions or comments for the discussion concerning the resolution now on the floor? Hearing none, all those in favor will, when your name is called, signify by saying aye. Those opposed, nay.
Frank,
Aye.
Porter,
Aye.
Radcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
6 in favor.
Who's the nay?
I'm sorry, 7 in favor.
Okay. It's unanimous. Next, we have motions for Committee of the Whole, Building, Planning, and Zoning, and Public Works of March 9th, 2020. Motions, in the absence of Chairman Freeman, will be presented by Vice Chair Stevens. Vice Chair Stevens, you have the floor.
Motion to approve the proposal from TRC in the amount of $40,100 for the 2020 landfill number 2 annual services. This work is included in the proposed landfill budget, account number 01-5-335-7900.
Motion out of committee. Questions, comments, or further discussion concerning the motion now on the floor? Hearing none, all those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Porter,
Aye.
Radcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
Frank,
Aye.
7 in favor.
Motion is approved unanimously.
B, motion to enter into an agreement with Lakeland Biologists for the 2020 Farmington Pond Maintenance Program at an estimated cost of $15,402. This work is to be paid for from the Farmington Ponds Special Service Areas.
Motion out of committee. Questions, comments, or further discussion concerning the motion now on the floor? Hearing none, all those in favor will, when your name is called, signify by saying aye. Those opposed, nay.
Radcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
Frank,
Aye.
Porter,
Aye.
7 in favor.
Motion is approved unanimously.
C, motion to approve low bid from Global Construction in the amount of $46,415 for the city's annual sidewalk program. The unit prices are $8.37 per square foot for removal and replacement of 4-inch sidewalk, $7.50 per square foot for removal and replacement of 6-inch sidewalk. Work to be paid from line item 01-5-310-6003.
Just a small clarification, it's Globe Corporation, not Global, just so that, for the recording. Motion out of committee. Questions, comments, further discussion concerning the motion now on the floor? Yes, sir.
I just noticed that it's cost more to remove the 4-inch than the 6-inch. Is that right?
That's how they bid it.
Any other questions or comments? Hearing none, all those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
Frank. Porter,
Aye.
Ratcliffe. 7 in favor.
Approved unanimously.
8, motion to approve low bid from Langton Group in the amount of $285 per mowing for mowing of water department sites. This work is to be paid from water department line item 61-5-810-6040.
Motion out of committee. Questions, comments, or further discussion concerning the motion now on the floor? Hearing none, all those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
Frank. Porter,
Aye.
Ratcliffe,
Aye.
Snow,
Aye.
7 in favor.
Motion is approved unanimously.
Portion 2 of D, motion to approve low bid from Lawn Maintenance Services in the amount of $520 per mowing for the mowing of the public works sites. This work is to be paid from the street department line item 10-5-310-6002.
Motion out of committee. Questions, comments, or further discussion concerning the motion now on the floor? Hearing none, all those in favor will, when your name is called, signify by saying aye. Those opposed, nay.
Arivalo,
Aye.
Brereton,
Aye.
Frank,
Aye.
Porter,
Aye.
Ratcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
7 in favor.
Motion is approved unanimously.
Third part of D, motion to approve the low bid from Lawn Care by Walter in the amount of $225 per mowing for Farmington Ponds. This work is to be paid for from Farmington Pond Maintenance Fund.
Motion out of committee. Questions or comments concerning the motion now on the floor? Alderman Snow.
And this is a question, I assume, for Brennan, the mayor, and the attorney. When it comes to these type of mowings for all three of these type of services, do these fall under the prevailing wage issues? And does anybody ever verify that they're actually paying whoever's actually cutting the grass for getting paid, lack of another term, union wages?
No, mowing does not qualify for prevailing wage. It's a maintenance activity. So the only one of our annual contracts that falls under prevailing wage is the sidewalk replacement.
Additional questions or comments? Hearing none, all those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Brereton,
Aye.
Frank,
Aye.
Porter,
Aye.
Ratcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
7 in favor.
Motion is approved unanimously.
E, motion to approve the low bid from Area Services in the amount of $23,705 for the 2020 landscape maintenance program. This work will be paid from the street department line item 05-1-5-310-6002 and 01-5-310-6826.
Motion out of committee. Questions, comments, or further discussion concerning the motion now on the floor? Hearing none, all those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Frank,
Aye.
Porter,
Aye.
Ratcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
7 in favor.
F, motion to approve low bid from Trees R Us in the amount of $54,600 for tree work from May 1, 2020 to April 30th, 2021 for the city of Belvidere. This work is to be paid for from the forestry funds.
Motion out of committee. Questions, comments, further discussion concerning the motion now on the floor? Yes, sir.
One question for Brent. I'm just curious how they come to this amount ahead of time. Do they know how much work we're going to need to do in the following year, or how do they estimate that?
We provide the estimated quantities, and then they apply the unit price to that, which arrives at the total then.
Any additional questions or comments? Hearing none, all those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Porter,
Aye?
Radcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
Frank,
Aye.
7 in favor.
It's unanimous. And that ends that section. Thank you, Vice Chairman Stevens. Next, motions of finance and personnel will be presented by Chairman Ratcliffe. Chairman Ratcliffe, you now have the floor.
Thank you, Mayor. G, motion to approve the appointment of Don Banks to the Community Building Complex Committee.
Motion out of committee. Questions, comments, or further discussion concerning the motion now on the floor? Hearing none, all those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Radcliffe,
Aye.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
Frank, Porter,
Aye?
7 in favor.
Motion is approved unanimously.
H, motion to approve the appointment of Natalie Mulhall to the Belvedere Planning and Zoning Commission.
Motion out of committee. Questions, comments concerning the motion now on the floor? Hearing none. All those in favor will, when your name is called, signify by saying aye. Those opposed, nay.
Snow,
Aye.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
No.
Frank,
Aye.
Porter,
Aye?
Radcliffe,
Aye.
6 in favor.
You are now appointed to the commission. Thank you, Ms. Mulhall. And thank you, Chairman Ratcliffe. Next up, under motions of public safety, motion will be presented by Vice Chairman Brereton in the absence of Chairman Crawford. Chairman Brereton, you now have the floor.
Thank you. Motion to approve the proposal from L5 Drywall in the amount of $12,525 for drywalling at Fire Station 1 upstairs remodel. This cost of work will be paid for from the building repair maintenance line item number 01-5-220-6010.
Motion out of committee. Questions, comments, or further discussion concerning the motion now on the floor? Hearing none. All those in favor of approval will, when your name is called, signify by saying aye. Those opposed, nay.
Stevens,
Aye.
Arivalo,
Aye.
Brereton,
Aye.
Frank, Porter,
Aye?
Radcliffe,
Aye.
Snow,
Aye.
7 in favor.
Motion is approved unanimously. Ladies and gentlemen, that brings us to the end of our festivities this evening. I'll entertain a motion to adjourn. Motion by Porter, second by Radcliffe. All those in favor signify by saying aye.
Aye.
Any opposed? We are now adjourned.